The first question we must ask, if we want to understand how to bring aging under medical control, is what makes aging special? What makes aging different from the other medical problems that we have already brought under medical control? And if we think about it, we've been extremely successful. And this success was a long time ago now. 200 years ago, we had huge problems from infections. More than 1/3 of babies, even in the wealthiest countries, would die before the age of 1, before their first birthday. And we fixed that pretty much completely across the whole industrialized world, just by simple things like figuring out that hygiene was a good idea. And, really simple medicines like vaccines and antibiotics. Even mosquito nets have saved an amazing number of lives. So what's different about aging? Why have these same simple ideas been so unsuccessful in pushing back the problems that people have in old age? Most people would say that it's this. Don't worry, you're not supposed to be able to read this slide. It's like, I'm just trying to emphasize that an awful lot of things go wrong with people when they get old, and they go wrong at more or less the same time, which means that they interact with each other and they exacerbate each other. So, most people think that this is all, that there is this huge complexity that has simply overwhelmed the efforts of medical research. And of course, that is partly true. There's no question it's partly true, but it's not actually the main problem. This is the way that most people think of sickness. They think of these three big categories of disease, and then they think there is this fourth thing called aging itself. So the problem with that is that it makes it sound as though aging is not really, even in principle, something that medicine could do anything about, because medicine is supposed to attack diseases. But it turns out that this is wrong. So in order to explain why it's wrong, I need to start by giving a really rigorous definition of aging. It's quite strange if you think about it that I would need to do this.